I'm Daniela Crousillat. It's lovely to be able to hang with everyone today. I'm a cardiologist and I'm the director of the cardio-obstetrical program at USF and Tampa General, and I'm delighted to be one of the co-leads on the PROMPT initiative. You may wonder what a cardiologist is doing in sort of the maternal and fetal world, but it really has become such an important topic, and we have realized how much multidisciplinary care is truly needed. So I am delighted to be a part of this and to be learning from all of you guys. So Margie Boyer and I were tasked with being part of the Driver 2 recognition, as you've heard about. Next slide. And for this driver, I love how Margie says, get back to the basics. So we figured that our initiative could not take off if we, first of all, didn't recognize the appropriate patients. And Bridget just highlighted that in terms of assessing and documenting if a patient is pregnant or has been pregnant in the last year. But really back to the basics, we meant like, how do you take a blood pressure? What is abnormal? Do you have the tools and resources to do that? And we wanted to make sure that we tackled that both from the provider perspective, meaning anyone that could be taking that blood pressure on the hospital side, but also that we tied in the nice sort of patient education piece of that, which is like, how do they take their blood pressures once they go home? And last but not least, we know there's a lot of data to support the role of interdisciplinary sort of simulation and training, which we had at our initiative. And that's because we know that when we grease our wheels and we try things out, when it's not sort of under real circumstances, we can really learn a ton from each other and from that debrief. Next slide. So we'll go into each of our drivers. I do want to highlight, and I know Robin did an excellent job of this. One of the things about our PROMPT initiative is we wanted to make sure not to forget about our postpartum initiatives here. This is definitely a hospital initiative, as you've heard from all of our other wonderful speakers, but this is the reality of what things look like in Florida. Here you're seeing data from 2020, where we had, unfortunately, 44 maternal deaths. And what you're seeing here, and that's compared to the blue bars from sort of the 9 years before that. But what you see here is sort of when in that time period are deaths happening, meaning is it prenatal, labor and delivery, or is it really postpartum, which includes before their discharge, but also after their discharge. And you'll see that really 60 to 70% of them are occurring in the postpartum period, and this is in Florida. And the latest in terms of Florida is that hypertensive disorders of pregnancy are still the leading cause of mortality here for us, although that's not necessarily the case in other states. So this just heightens, I think, both the reason why we're taking on this hypertension initiative, but also secondly, why we just can't forget about what happens to women when they're discharged home with their babies. Next slide. So we talked about this a little bit. They're really, if we can't recognize the patients that we need to do this initiative on, then we really are not going to be able to get anywhere. And it's amazing. Bridget mentioned, I think it's Sarasota Memorial. They have this built into their EMR, and we felt like this was the absolutely sort of one of the most important things we could do to lead better practices in terms of identifying all patients who present anywhere, ED, OB, ED, OR, maybe you don't have one of those, L&D, to make sure that we are recognizing women, not only who are currently pregnant, but who have been pregnant or delivered within the last 12 months. So I'm excited about this. I think there's a lot of wiggle room here for growth in all of our different hospital systems about how we get this into the EMR. And we have some great things in our toolkit, which will include for people who have Epic. We know a lot of our hospitals in Florida have Cerner as well. And this is a place where I think we could really sort of work with our physicians, but also our EMR to try and make this a part of the workflow for all of us. I think at the same time, we can work with EMR and our providers, but we, as I mentioned, are also trying to empower the patient. So there's wonderful, and I think I have some examples of it from our PAC initiative, where some places are posting signage in the ED, some patients are getting wristbands, for example, from the Preeclampsia Foundation. Some centers have their own, but the purpose of that is if we don't identify you or we don't ask the question, can we advocate and empower patients to identify themselves? You know, things like moving up to the line or telling someone that you've been recently pregnant or recently delivered, because I think if we hit it from all fronts, we'll be a lot more successful. Next slide. So this is sort of an example. I think it's from A1, where it says, tell us if you are pregnant or have been pregnant. This says within the past 6 weeks. We'd even stretch this to like within the last 12 months. But the goal of this is we see a lot of the serious complications from hypertensive complications postpartum do happen sort of in those first couple of weeks. So I really love this infographic. Next slide. And these are really, really good examples from a recent PAC initiative, which I know a lot of you guys are a part of. These are signages that we, on the left-hand side, that we highly recommend, or things that are placed, for example, in your emergency room. They come with QR codes. They include hypertension and preeclampsia, but they also have other important maternal warning signs to be considered in the postpartum period. On the right-hand side, you'll see our wallet card. We encourage our patients not only to carry this around, but we know how easy it is to lose a piece of paper. So we also encourage them to take a picture of it. And this is nuts and bolts. I gave birth on so-and-so date. This is where I delivered. This is the contact, for my OB provider, or if they have a cardiologist, and these are the medications that I'm on. That way, hopefully they have this easily accessible, independent of where they end up. Next slide. So this is really the back to the basics and ensuring that we know and we teach everybody to accurately measure a blood pressure, because if our blood pressure measurement is not accurate, then we're acting on information that is not accurate. And that could go both ways, right? What if it's low and we're administering medications that could then more dangerously lower it? Or the other way around, maybe we're not catching how high it is and we're underestimating the severity of the true high blood pressure. This is sort of where it depends sort of who's checking the blood pressure at your hospital, who needs to be trained. In the next slide, we'll talk about some company assessments that we're doing for providers. We understand that a lot of hospitals have moved to automated only. It's like really hard to find a manual blood pressure cuff, but we do still mention, as I think CMQCC does, that the gold standard for blood pressure measurement still remains doing a manual check as a way to confirm an automated one. That being said, we sort of, leave some wiggle room. Some of these automated ones are calibrated, they are standardized, and if that's what's available, then we encourage confirmation on a validated device. Next slide. And this is wonderful. This is also from A1, who is fantastic. Stuff of back to the basics on adult blood pressure management. We love this one because it's not just like, how do you do it? But it's sort of like why, and the importance of communicating, not just with the patient, as Mandy has alluded to, which is really so nicely woven, the patient and sort of family interactions. I think it's just so key in all of our drivers. So what are you taking it? Why are you taking it? Is it abnormal? And making sure that we're communicating our concerns, what we're concerned about, and what the next steps are going to be. So we're going to have in our toolbox and toolkit some blood pressure competency tools, and also I think a PowerPoint on competency assessment as well. Next slide. So everyone has really nicely highlighted this, and that's the fact that it's not over when you go home, and hopefully the discharge paperwork shouldn't say treatment is delivery. So I think this is really where we can make the most headway in terms of education and ensuring we're educating not just our patients that are diagnosed with preeclampsia or hypertensive disorder pregnancy, but also their families, their support persons, or anyone who may be available. I think education on emergency signs, we have lots of nice educational materials on that. I love that Robin mentioned the fact that things have to be culturally relevant. We also have seen an increase in our Haitian Creole population, and we have a very large Hispanic population and Spanish-speaking population here in Tampa. So it's important that not only to have things in multiple languages, but also that people learn in different ways, whether it's a video that's available when they're being discharged, whether it's a handout. I think we just have to be conscious that people learn in different ways. So we're happy to be able to provide sort of a host and a toolkit of different resources so that people can sort of cater that to other people's needs. Next slide. Perfect. And this is the A1, Save Your Life. These are the post-birth warning signs as an example on the left-hand side, and from the right, we have some from the AIM bundle as well, urgent maternal warning signs. Great examples of some of the work that you're going to be seeing coming from this driver. Next slide. So we alluded to this a bit. So part of it is not just like, how do you take your blood pressure, but this is really educating the patient on how to use it appropriately, hopefully in a sort of monitored and observed way before they actually leave the hospital, to ensure that they're also getting accurate measurements when they go home. And I know part of our initiative, Lori, has worked to make blood pressure cuffs accessible to many of our medical centers across Florida who are not able to provide this. And I know a lot of us are working in the background too, just to have this be covered for really all of our pregnant and postpartum women, hopefully by insurance. So access to resources is really important, and we welcome your feedback on sort of how this is going and whether it's been feasible to actually ensure that every postpartum woman who needs it has a blood pressure cuff to go home with. And I think we'll talk a little bit in the next driver about how sort of important that is. How do you bridge that follow-up? What kind of contact information do you give them? And how soon after we discharge women should we actually be seeing them on the postpartum side? Next slide. And this is Margie's favorite and mine too, if you want to add anything, Margie, but we had just a fantastic simulation that we did at our PROMPT kickoff, and we were trying to figure out ways of how we could recreate this for a mini kickoff today. But there is, we learn from these every single time. I think the debriefs are just as important as the actual simulation, and this allows us to grease our wheels, whether it's where the med's available, should pharmacy be involved, was respectful maternity care provided, did we follow our nurse-driven protocol that may be new for some of us as we're starting this PROMPT initiative. So we think this is a wonderful idea to really kind of get comfortable with some of the changes you guys may be making through this initiative. Next slide. Perfect. And it's just a plug for the really the AIM bundle, and also the webinars that are available through their website are just truly fantastic. And I would say definitely worth your time. So just an extra plug for that. Thank you to Robin.